Breast cancer surgery. Introduction. Lymph nodes allow excess fluid to drain back from the breast area and the arm to the bloodstream. Select true or false. Correct. Breast cancer could spread to other parts of the body through lymph nodes. The two main goals of breast cancer surgery are 1. To remove the whole tumor, and 2. To check the lymph nodes to see if any cancer is spread to them. Select true or false. Correct. Breast cancer operations have two main goals. The first is to take the whole tumor out without leaving any tumor behind in the breast area. The second goal is to check the lymph nodes of the axilla to make sure that the tumor has not spread to them. There is one standard breast cancer operation. Select true or false. Correct. There are many different operations to treat breast cancer. You should discuss with your surgeon the one best suited for you. Are strokes and heart attacks common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, however, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, seromas, as well as bleeding and scarring may occur. It is impossible to injure the nerves, arteries, and veins going to the shoulder or arm. Select true or false. Correct. These nerves could be injured, leading to permanent paralysis of the arm or shoulder. However, this is very rare. Another operation may be necessary, especially when a limited operation is done. Select true or false. Correct. If the pathologist determines that there is a possibility of residual tumor in the breast, another operation may be needed. Breast removal is the only procedure available for treating breast cancer. Select true or false. Correct. Breast conservation therapy, which includes removing the breast lump, lumpectomy, the lymph nodes, axillary lymph node resection, followed by radiation therapy, can be an equal alternative treatment to breast removal, modified radical mastectomy. You and your doctor will decide the best choice for you. Thank you for using Explain.